Good morning, everyone. My name is Jelita Putri Nabila. Today, I will present my proposal or research poster titled Comparison of FEV or FEC ratio among obese high school adolescents based on obesity degree and gender. So first of all, on introduction, obesity in adolescents can affect lung mechanics and reduce chest wall compliance. While FEV1 and FVC findings are inconsistent, the FEV1 or FVC ratio is often lower in obese teens, suggesting airway limitation, and few studies compare this ratio across different obesity grades or between genders. Even though fat distribution and lung growth may vary, this study examines how obesity degree and gender affect FEV1 or FVC ratio in obese high school students. So, first of all, what is obesity? Obesity in adolescents is a rising health issue worldwide, and the definition is obesity as excessive fat accumulation that may impair health in adolescents. It's usually diagnosed using body mass index. And one of the systems affected by obesity is the respiratory system. Fat deposits in the chest and abdomen can reduce lung compliance, diaphragm movement, and thoracic expansion, and all of which can affect pulmonary function. Meanwhile, the main focus of the study is on forced expiratory volume in 1 second or FEV1, a key parameter measured by spirometry, and FEV1 reflects how much air a person can forcibly exhale in the first second of a breath. And another important parameter here is FVC or forced vital capacity, which measures the total amount of air exhaled during the test. And the ratio of FEV and FVC is often used to assess if there is any obstructive or restrictive lung pattern. A low FEV1 or FVC ratio may indicate airflow obstruction, while a normal ratio, which reduces FEV1 and FVC, may suggest a restrictive pattern, which is common in obesity. And here we got the statistic of obese adolescents in Indonesia. In 2018 National Basic Health Research Survey, they found 1 in 7 adolescents aged 13 until 18 in Indonesia are overweight or obese. Meanwhile, a research conducted by Sarin Tohe et al., private school teens in 2020 study are 33% overweight, or the male are 47% overweight, and the female are 24% overweight. And here we got the research problem and objective. And what we want to do is we have to find is there a significant difference in FEV1 among obese adolescents based on obesity grade and gender. And this study aims to compare FEV1 values across different obesity classes and between male and female adolescents. And based on the literature review, the rising issue, adolescent obesity, is increasing worldwide and affects lung functions. And mixed FEV1 results studies show higher, lower, and unchanged FEV1 in obese teens and no clear consensus. And lower FEV or FVC ratio often decreased in obese adolescents, indicating possible airway issues. And the data gaps here is limited research on FEV1 differences by obesity severity and sex in teens. That's why, based on the data gaps, I wanna use this method on obesity and differentiate it between the gender on the grade. And the materials and methods here are study design. We use cross-sectional observational study, and the participants are obese senior high school students aged approximately between 15 until 18, and grouping based on obesity degree, grade 1, 2, and 3, and gender, male or female. Obesity classification using BMI for age percentiles based on WHO growth reference. And data collections, here are the age, weight, height, and gender, and measurement using FEV1 assessed using spirometry, and standardization. Here, procedures follow ATS or ERS, American Thoracic Society, or European Respiratory Society guidelines. And the analysis here, descriptive statistic, and comparative tests using ANOVA or independent t-tests. Our expected results here are anticipated decline in FEV1 with increasing obesity degree and expected difference in FEV1 between men and female subjects due to anatomical differences in lung volume. And here are the references I used for my proposal, and maybe that's all I can present based on the poster I've made. Hope that what I conveyed can be understood very well, and I'm sorry for any mistake that I made here. Thank you so much. Wassalamualaikum warahmatullahi wabarakatuh.